Okay, we're going to talk about another one of my dad's protocols, this time for the sinuses. What did Dr. Ingram recommend for the sinuses? Okay, and this is not medical advice. It's not intended to diagnose, treat, or cure any disease. And if you have a medical issue or a problem with your sinuses, please see your doctor. Okay, so Dr. Ingram, he would recommend wild oregano under the tongue. Okay, so you would take the wild oregano and put a few drops under the tongue, like so. You put a couple drops under the tongue and you hold it there for 30 seconds. And have some water next to you because it's very intense, and you're going to need to drink. Most people. But also less known, not as commonly known, is his protocol for intranasal wild oregano. I know that doesn't sound very pleasant, but we'll dive into that a little bit. And that involves using a cotton swab. And I am not a doctor. My father was, and he wrote about this protocol in his books. So we're going to cover this. Okay, so what about the why? This comes from his books, in particular the respiratory solution. So your sinuses and nasal passages are not empty space. They're one of the hardest working filtration systems in your body. They act as radiators, warming the air before it reaches your lungs. They act as filters, trapping dust and particles, and they act as air conditioners, adding moisture so dry air doesn't reach the lungs. Okay. And so he says lining all of it is the cilia, tiny, velvet soft, hair-like fibers my father called a living conveyor belt, consistently sweeping everything they catch down and away. Here's the thing about the system. It's warm, it's moist, and it's dark, which is exactly why keeping those membranes healthy and the conveyor belt moving matters. Especially in the winter when forced dry heat dries the membranes out, or after travel when pressure changes congest everything. So my father's approach was to support the natural self-cleaning directly at the source. Quote from his writing on the sinuses: the oil may be rubbed on the sinus regions, like on the forehead or on the cheekbones, or inhaled directly. And that's verbatim. So, okay, so the easiest part, under the tongue, we'll just take some drops. This is the most common method, and put a few drops under the tongue. And then we just hold it underneath. I didn't actually do it because I'm not ready for it right now. I don't have my water next to me. But you do that 2 or 3 times a day. And he also recommended in some instances 5 or more drops. But to start with, it would just be 1 to 2 drops per day. And you can work up to a larger amount. It is quite potent. Okay, so then the technique that most people miss over here. Okay, and after placing it under the tongue, you press the tip of the tongue gently against the tissue for at least a full minute before you swallow, as long as you can handle it, and have your water next to you. And under the tongue, the oil goes directly into circulation, so that minute does make a difference. Now the part that the video is really about, it's the sinuses, the sinus protocol, I should say. And my father described it in 2 ways. Something that you can do with your wild oregano bottle, and you don't really need anything else. And then there's something that he wrote about that we don't currently make, that is a nasal spray. Okay, so we'll talk about both. Method 1. Okay, so you're going to need a cotton swab, and you can need the the wild oregano. Okay. And so we'll go ahead and apply. I'm just gonna put a really small amount of the wild oregano on the cotton swab over here. Okay. Just a tiny amount. I sometimes do actually drench it, but I wouldn't recommend that if you're just starting out. And if it's too intense for you, it's going to be intense. I'm going to warn you about this. It's going to be intense. So just, you know, like you could dilute it further in olive oil. So that is an option. Okay. So, and then so he recommends this against the inner part of the nose, or the wall, the septum, okay, to be rubbed against the septum on both sides. And this is going to cause a lot of sneezing too. So that's what, at least from my experience. So yeah, he said along the medial aspect, the inner side, avoiding the sensitive outer membrane. So that's this. I actually have some ice cubes here in case I get impacted, in case I impact that area, because it's going to burn quite a bit on that lower part of the nostril. So you just do one nostril and do the next. And it's going to be intense. So just have the expectation there's going to be a heat sensation. And he wrote about that, but it's temporary. That discomfort is temporary. And so, yeah, if it is too intense, then dilute it further, or we can use other methods, like the nasal mist, a saline nasal mist, sea salt and water base, combined with the oil of wild oregano, wild sage, and bay leaf. Okay. And we don't currently make that, but that's something that can even be made at home if you have the ingredients. Okay, so yeah, I'm going to go ahead and do this now. Just putting it on the inner part. It feels kind of awkward to do this on camera, but I'm just going to hold it there as long as I can take it. And breathe it in. I put a lower amount than what I usually do. I'm going to do the other side as well. Another nostril. This is the inner side. Okay. Okay. All right. So that's it. Let's see. So, yeah. That's the nasal protocol, intranasal protocol, with the Q-tip. Okay. And okay, and we talked about the spray and the sea salt and water base combined with the wild oregano, wild sage, and bay leaf. Okay. Okay. And then the other one, which is a lot gentler, which I do quite often, is really just breathing it in, to be honest. It's just breathe it in, inhale it. It's really nice, actually. Feels good. That's good. Or you put it on the fingers. It's even better. You can get it closer. I sometimes do this too. I was doing this after I was going into the steam room, and just putting it on the fingers. That's really good. So you're taking it internally and you're taking it intranasally, and you're inhaling it. That's good stuff, actually. Okay. All right. So yeah. So Dr. Ingram is also saying here, inhale it. We talked about that. A few inches under your nose. Breathe in the vapor. So he wrote, you can put a drop on a tissue and inhale from that as well. He said, dry air is the enemy of healthy sinus membranes. So forced air heating in the winter is one of the biggest culprits. Humidifier, a bowl of steam, and a hot shower can help keep the membranes moist. Fresh air, Dr. Ingram wrote that the fresh air cleans the sinuses. Time outdoors, even 10 minutes matters as well. Add whole food vitamin C, camu, rose hips, vitamin A, rich foods like wild salmon. So some dietary advice from Dr. Ingram, onions and garlic when you're cooking. He wrote about how those may naturally thin and clear the passages as well. So this is not also a one-time fix or anything. Dr. Ingram did not recommend doing this one time, but doing this consistently. And the heat passage, it does fade after a while. So that's just something to note. Okay. So precautions: avoid contact with the eyes. The swab goes along the septum, the inner divider, never the eye, and avoid the outer membrane as well. If it does get in the eye, flush with cold water. Start low, start under the tongue, a small amount on the swab. Never to children under 4. Okay, and if you're pregnant, discuss with your healthcare provider. That's out of an abundance of caution. I also found that quite soothing, applying the wild oregano topically. I did a video on that recently, applying it to the temples, to the crown of the head, to the part of the spine where it meets the skull, and behind the ears, the cheekbones. So I found that quite helpful as well. Okay, so that's all there is on the nasal protocol. So there's a guide on this protocol available as well, and you'll find the link to that guide in the comments and in the description to this